if you are running a university and you are admitting students, you should set a standard.
The poor man on the street cannot fight for his right again.
Our human rights on a daily basis is being abused.
Voices of ordinary Nigerians, their polls on issues that affect their lives and the society, from politics, environment, economy, power, health to family issues.
Just remember that she is a human being as well.
We were in darkness for 2 weeks.
Of course, there was a day the transformer packed up.
Roving correspondents are on the street, in your neighborhood, talking to you and letting you have your say on anything and everything, all for the common good of all. Pause on NTA2 Lagos Network Center, Wednesday by 6:30 in the evening, and a repeat broadcast on Saturday by 6 in the evening. Follow the mood and views of the people, only on the Pause.
In terms of the solution in addressing this case of insurgency and the state of security in the country.
It is disheartening to note that most Nigerians still treat
because
the
I want to send a message or because I want to entertain and relax.
It is back with a bang. Bigger, better, and more impactful. It is the biggest ride on television since 1988. Morning Ride, your choices breakfast magazine show on NTA2 Lagos, every Saturday, 10 a.m. For sponsorship and advert placement, contact the marketing department, NTA2 Lagos Network Center, Ahmadu Bello Way, Victoria Island, Lagos. Morning Ride, taking you on a jolly good ride.
Nigeria celebrated the 55th anniversary of national independence from colonial rule. The most important information on everyone's lips seems to be political and socio-economic related issues. And the big question was, how far so far? In 55 years, how far has Nigeria come? Now, the president said it all. He said, we are not there yet, but one thing we must tap into is national unity. Talking about how far so far, today we will be looking at the Nigerian Health Care Industry at 55 and medical tourism. In 55 years, how far has Nigeria done? Of course, there were healthcare facilities in the country even before 1960 when we gained independence. But the British people, the missionaries, handed over a couple of these institutions to Nigerians to handle. And today, we'll be looking at how far. Are we where we are supposed to be in terms of healthcare? Good evening, viewers and friends out there. From wherever you're watching this show, thank you for giving us your time again. My name is Dr. Obinna Nwaneri, and you're welcome to Lifeline on NTA2. Joining me to analyze this all-important topic in this special post-independence episode of Lifeline is someone we have a lot of respect for in the medical world, both here in Nigeria and in the diaspora. He is a consultant hematologist and medical oncologist. Currently, he serves as the Director of Haematology and Oncology, St.Nicholas Hospital here in Lagos. Dr. Obinna Nwaneri, thank you for coming to the program.
Thank you for having me, Dr. Gidi.
It's a pleasure to have you. So we are looking at the Nigerian healthcare industry at 55. Now, I had to do a lot of research because this topic is not a topic where we are coming to say what happens for cancer and what does not happen in terms of symptoms. We want to explore and analyze how far Nigeria has come. And I'm very excited to be talking to you because, like I told you before we started the show, the most extensive information I could get on the history of healthcare systems in Nigeria was put together in a keynote address by a pediatric hematologist and oncologist, a Nigerian who had done a lot of work in Michigan and was invited then by the Minister of Health to come and tell us what he had done during his research period. Now, from your own experience, I know you started from the University of Nigeria Nnsuka, and then you had gone out to the United States where you had done a lot of work, and now you had been coming from time to time. In 55 years, how well would you say Nigeria has done in terms of healthcare?
Well, thank you very much, Dr. Gidigbe. And it's a pleasure really to be here today to talk to people about our healthcare in this Independence Day anniversary.
Yes.
And we pray and we continue to dream for the best for Nigeria. Our healthcare in Nigeria has stagnated.
Okay.
And that's the one word I'll use. We have stagnated when you look at what has happened from the 70s to the 80s, to the 90s, and today. And for me, I have been lucky, I would say, and privileged to have seen both sides. I've been in the United States system, where they are the cutting edge of healthcare.
Of course.
But I am also a Nigerian. I love Nigeria very much. And I've seen our healthcare stagnate. And that has led to the bad outcomes we have, the poor outcomes, and actually, most importantly, capital flight by way of people going...
Medical tourism.
Medical tourism. I think you're going to talk about that too.
Yes, yes.
So all those are quite related. And one other issue I've noticed is the fact that our leadership doesn't trust, or if they do, they actually pay lip service to our healthcare system in Nigeria, because action speaks louder than words. When the average prominent person is sick, they leave the country. So the average person in Nigeria who feels sick also does want to leave the country if they can afford it, because they are thinking that, well, our healthcare is not good enough for the leadership, then it's likely not good enough for me if I can afford it. And therein comes the rub. Then we do not develop our own healthcare system, and it has stagnated thus far.
Oh, okay. According to Dr. Nwaneri, the healthcare system has stagnated thus far. Now, before we even find out what some respondents that we spoke to out there think about this issue on this August 55th anniversary of the polity called Nigeria, it is important for me to state clearly that the first healthcare facilities, as I get here from this summation by Dr. Ajovi, the pediatric oncologist, he found out that report showed him that the first healthcare facility in the country was a dispensary opened in 1880 by the Church Ministry Society in Obosi, that is in eastern Nigeria.
Wow.
Yes. So as early as 1880, there was already a healthcare facility in Nigeria. And then there were other facilities opened, like the Sacred Heart Hospital in Abeokuta, built by a Roman Catholic Mission in 1885. So these were the initiation of healthcare. And he rightly stated that it was the foreigners, the colonialists who had come to do their trade that had to bring people, because malaria was a problem and all of that. Now, from that time, even as at 1960, he stated that missionary hospitals were much more than government hospitals.
Correct.
And we will come to that. And he said both the quality of missionary hospitals at the time and the quality of government hospitals were top-notch.
Correct.
even in 1960, where power was handed over. Now, before we go ahead to analyze these issues, let's find out what our respondents had to say in terms of the healthcare industry at 55 and medical tourism.
The health sector is poor. It's poor. We need to train our doctors, you know, and our medical practitioners. And again, the infrastructure is poor. Medical infrastructure in hospitals is still very poor. You know, if you go to our general hospitals as we speak now, you know, before they will attend to you, an attitude of doctors and nurses there, and in fact the drugs that they're supposed to sell in a kind of considerable price, you know, by the time they calculate everything together, you know, you don't know what to do, especially for those that are poor. That's why we have high rate of you know, death rates in the country. By the time you go to hospital, before you pay your bill at all, people that cannot afford 3 square meals, at the end of the day, they just died. And that's why you can see that if anybody gets sick among the rich in Nigeria, they flew them abroad.
Health sector is a significant, it's a very important aspect of human existence. I think a lot of attention has to be paid to that sector. Financially, they have not been, many of the hospitals are not well equipped. I think a lot of priority has to be given by the government into the health sector.
In terms of health sector, we are still far behind. As a country, I believe by now, we should be able to have confidence in what, because you know, we have federal hospitals, we have state hospitals, and we have private hospitals, but we still don't have confidence. That's why any little thing, we tend to travel abroad for treatment, and we end up spending huge amount of money, which we would have invested into the country for better. I mean, I don't think health-wise we've gone anywhere. We still have a lot to do, and I'm urging both the government and every citizen to rise up to this challenge.
The attitude of the people, no matter if you carry a monkey go London, train am, you still remain monkey. If you show a banana, you go chop am. The attitude of the people, no matter if they have it at their backyard, they will still want to go to India, they will still want to go to London, they will still want to go to America to restrict treatment. That's just it. If they can change their attitude also, and with the private sector going into the health sector and the government sector coming together to improve in the health sector.
The health sector right now, it's not doing that much because we still have people complaining of health hazards. We have displaced people as a result of terrorism, and they've not been adequate care for. We are using this opportunity. Actually, we are using this opportunity to tell the Nigerian government that they should do more about the health facilities and make sure all those things are in place so that people will not suffer for life.
You're welcome back to the studio. You're still tuned into Lifeline on NTA2. And on this special post-Independence Day edition, we're looking at the Nigerian healthcare industry at 55 and medical tourism. How far so far? Now, you just heard from fellow Nigerians like you and myself, and the general opinion is that Nigeria hasn't gone anywhere at all. Some of them feel that it's because of the attitude of the government, while others have different opinions. But coming to you, Dr. Obinna Nwaneri, from your own opinion, I know that you are a man with a lot of experience in terms of healthcare worldwide. What are some of the areas you would want to cite out to say are the particular reasons why the healthcare industry has stalled in Nigeria since 1960?
Well, thank you very much. And I think some of the people that spoke really brought up some issues. Again, the issue of attitude is significant. However, there are many things that have affected our healthcare system in Nigeria. One major one is lack of adequate and appropriate funding for healthcare. The WHO recommends a certain amount of money to be spent in each country on healthcare each year, and we come nowhere close to that. The recommendation is a minimum of at least 7 to 10%. I think the last time I checked, Nigeria spent about 3% of its GDP, gross domestic product, which is all the money the country makes on healthcare. We should spend much more than that, more than 3%. A country like the US spends about 20%, which is the richest country in the world. In the United Kingdom and in most countries in Europe, they spend about 10, some even spend up to 15%, but that is the exception. So we don't spend enough on healthcare. Also, there is little or no health insurance. And I think that's an area which should be looked at, because insurance just means everybody is pooling healthcare, their money, and when somebody is sick, the rest of us takes care of them, and then so when we're sick, we also take care of that person. So I think those are some just issues which I think are affecting our health in terms of stagnation, because we do need a lot of investment in healthcare as an industry.
Of course.
And for also Nigeria, as I say, money is expensive in Nigeria. So the private sector hasn't really been able to go up on their instruments and their equipment
to kind of participate
in the growth
fully.
in healthcare. Yes.
Well, viewers and friends out there, I hope you are getting the analysis, but forgive me for not having mentioned earlier that you can also be part of this analysis if you tweet at me via @Dr. for those on Twitter. Just kindly hashtag NTA2 Lifeline and send in your tweets. Search @Dr. on Twitter and tell us what you think about this all-important topic. We are trying to get your feedback. You can also send a message through Facebook if you go to www.facebook.com/Dr. Now, Dr. Obinna Nwaneri, coming back to the issue, it is important for me to read this excerpt from an article that was written in 2010, and then we will develop from this so that you can respond. Now, it is stated clearly here that Nigeria is currently made up of 36 states, of course, and the Federal Capital Territory, and over 500 local government areas. At the moment, it's over 700 local government areas. Each local government area, this was the plan for coverage, for health coverage, as in what seemed to be in the 80s. Now, each local government area is made up of 150,000 to 250,000 people, as it were, just an estimate. Now, by the scheme proposed in one of the National Health Development Plans, the one that was supposed to cover 1981 to 1985, each local government would have had a minimum of 7 primary health care centers and 30 health clinics, which at least one with a comprehensive healthcare center, what has metamorphosed into the teaching hospitals now, as it were. Now, the larger local government would each have at least 12 primary healthcare centers and 50 health clinics feeding into one or more comprehensive healthcare centers. Now, this was the plan. As stated here, Nigeria has not come close to achieving this lofty objective, so that the numbers of healthcare centers that are supposed to feed the people, even as the population grew, is supposed to be a particular amount, and it's all been in the plan. But as stated here by this author, Nigeria has not come close to this objective. And this brings me to the question of the ratio of healthcare facility, the ratio of doctor to patient. Now, that seems to be suffering. I could not get the statistician to come on the program as I wanted, but apparently the number of doctors and healthcare centers are not enough. Now, you have rightly stated funding as one of the reasons why Nigeria has stalled in terms of healthcare. But other than funding, what would you say is another reason why, in terms of these figures that we are just stated out, why we are not able?
No, thank you. I think another issue is brain drain, which is a major problem, with doctors who are trained within sub-Saharan Africa and poorer countries now go to quote-unquote greener pastures to receive more extensive training and end up working in these places. And so doctors from sub-Saharan Africa fill up hospitals in Europe and America. The other issue is investment. Again, I still come back to investment in healthcare. Currently in Nigeria, we have approximately 7 radiation centers in the whole country for a population of approximately a little over 170 million people.
Radiation centers for cancer treatment.
For cancer treatment, and that's this is an issue which is very close to what I do today. There was a month in December of 2014 where there was not a single radiation facility working. There's only one privately owned radiation facility in the country, and so if there is a strike, as you know, we have lots of strikes.
Yes.
All the teaching hospitals will be closed. Then the only privately run radiation facility is at Eco Hospital in Lagos, and about that time it was undergoing some renovation. So for a period of time in Nigeria there was not a single functioning radiation facility, which was such a tragedy. So we have the issue of poor funding, we have the issue of lack of government commitment, we have the issue of lack of insurance, and then we also have the issue of brain drain.
Okay,
Then finally, we have the issue of our population, people not being educated about what they should do about their health care. So we have the healing centers, the faith places, faith-based organizations not really directing people to do what they should do, which is go to a hospital, they have a breast lump, seek a doctor's help, but people saying, it's not my portion. I'm sure you've all heard that in terms of taking care of themselves. So attitude, somebody mentioned, is also a big one, but again, also a lack of trust in the system. So there are many issues that come up, but I think a focused view on healthcare for the population will help. In terms of gradually trying to improve our quality of healthcare and move us along from a period of stagnation to a period of improvement in our healthcare in Nigeria.
Well, going straight to solutions, because like the president rightly mentioned yesterday, it shouldn't be an issue of what has happened in the past, what needs to be probed right in the past. Now, we are all looking forward as Nigerians. As one Nigeria, we want to see what happens in the future, and we are hoping towards a better future. Now, this author, Dr. Scott Imakpo, has rightly stated that which way forward in the 21st century, and he identified that the solution as the problem of, he says the problem of healthcare in Nigeria lies with the medical doctors and the workers in the healthcare industry. That would be in the spirit of taking responsibility. Now, you've mentioned government interest, private interest, all of this not enough. Even the amount of information available to people not being enough as some of the reasons. But in terms of moving forwards, he has cited that we, the medical doctors, and other members of the healthcare industry, nurses, pharmacists, we have a very huge role to play. And like a lot of enthusiasts have said who believe in being one, national progress, the change has to start in us. So in terms of solutions, talking about solutions, I mean, you're at the stage of your career now where you can rightly be called to come and profess solutions. What would you say are some of the ways that the Nigerian healthcare industry can progress?
I think the Nigerian healthcare industry has a lot of things to do that can make some significant changes. For one, I agree the healthcare professionals need to come together and realize that they do have some clout. They do have a role for the populace, for the public to say, this is the right thing to do, this is the way it should be done. And also the constant bickering between professionals, nurses and lab people and technicians and all that, makes for the healthcare system not to work, because we all form a team. It's a team effort to take care of a single patient. And so that should continue. But I think I agree with Dr. Scott Emakwa, that we need to take control of healthcare in Nigeria, the healthcare professionals. And so I am hoping that that will work. But again, the political cloud, we need to talk to our legislators.
Of course.
We need to be involved, because the hands-off approach, which doctors are, noble profession, I don't want to make any noise. If that's what they give me, I manage with it. There should be some activism.
Yes.
However, the activism should not be in form of so many strikes and making patients suffer, because the whole process on becoming a doctor, you are sacrificing quite a bit to society, and society does appreciate that, and so I think that's an area where healthcare professionals should look at, in terms of more activism, more looking at how we can make things work much better than what we're doing now in terms of these incessant strikes, and asking for basically crass money. And the money that we tend to ask for always are for salaries.
Yeah. Not the development.
Nobody's saying I want more radiation facilities, so I won't do it. Nobody's saying I want a better equipped theater, so I won't work. No, they're saying, oh, I want a higher pay.
Oh, well, Dr. Nwaneri, the time is always not enough on every episode of the show. I'm sure that very soon we'll have to apply to increase this show to 1 hour. Unfortunately, it's a 30-minute hour. Viewers and friends out there, this has not been very much of a teaching section where you should find out what symptoms for what conditions. But of course, Dr. Nwaneri has nicely analyzed what some of the problems of the healthcare industry in Nigeria have been. And he has also preferred solution. We, the doctors, need to get a bit more active. And then the people need to demand more from the government. There need to be funding in the healthcare industry. We need to be able to meet up with people in other aspects of the world, so that instead of going all out in terms of medical tourism, you can assess some of those treatments and other aspects of healthcare services back here in the country. Dr. Nwaneri, I want to thank you so much for coming to contribute your own quota. Like it's rightly said, you are contributing your own quota. We need to start from ourselves and then inform the people if things have to get better in Nigeria. It's been a pleasure talking to you.
Thank you very much for having me, and I hope all of us get involved. As the president said yesterday, this is our own country. We're going to build it. We've been together. We're going to be together. And happy independence to everybody. And thank you for having me here.
Thank you, sir. Viewers and friends out there, I'm afraid this is the most we can take on this episode of this program. As I wish you a happy independence, I also hope that you have a very lovely evening ahead. Until same time next week, see you around.
Hello and welcome to another interesting edition of Art and Leisure. Welcome to Art and Leisure. So nice to know you there. In a jiffy, we'll be in Benin to meet her first female broadcaster. There's so much going on here.
Yes, it's actually a very strong wood.
There are 48 national museums in Nigeria. You know, so many people spend time complaining about the bad things around. Sometimes I do, but you know what? These days, I choose to focus more on things that make me happy, things that help me to relax. That's what Art and Leisure is about.
Lagos comes alive as Nollywood Entertainment Limited, in partnership with NTA, moves Zafa Global Awards to Nigeria for the first time.
I think it's a great idea. I totally endorse the move. It's magnificent. It's good for the industry. It's good for Nigeria.
A glamorous event, a celebration of African movies, culture, fashion and creativity. It's a 3-day gathering of leading international stars, filmmakers and movie professionals.
Zafa, you're welcome to Nigeria. It's a welcoming development. And NTA, the largest network in Africa, I want to say thank you for bringing Zafa into this country.
Featuring movie screenings, exhibitions, masterclasses, business seminars, live entertainment and awards. Highlights, Special Recognition Awards by British Film Institute. Date 29th to 31st of October 2015. Venue, Eco Hotel and Suites, Victoria Island, Lagos. For sponsorship and advert, please contact Chinedu on 080-231-33380 or Dembo on 080-544-089-000. Email purplerain.consult@gmail.com.
Niger, let's do it again!